Ms. Campbell, you testified before the Health Subcommittee on September 10th, correct?
That's correct.
And at that committee, at that hearing, you testified that CGI Federal was confident that it would deliver the functionality that CMS directed qualified individuals to begin enrolling in coverage, correct?
That's correct.
And in your written testimony of today, you also testified that CGM and others developed a design and it passed the 8 required technical reviews before going live on October 1st, correct?
That is correct.
And either at that hearing on September 10th or until just now, you have never testified that that there was insufficient integrated testing to know whether the exchange was going to work, correct?
There were no
I never saw any of your testimony that you ever said in those hearings that more testing was needed, and I was there.
So is your question whether I testified if testing was
That's
needed?
correct. Did you ever tell this committee that more testing was needed to make sure it would work?
I don't believe someone
Thank you.
asked me that
now,
question.
Mr. Slavitt, I'm sorry, I have very little time. Mr. Slavitt, you were our only witness who was not here on September 10th, but Mr. Finkel from your organization was. And on September 10th, Mr. Finkel testified, quote, our delivery milestones for Data Service Hub completion are being met on time. We expect CMS Data Service Hub will be ready as planned by October 1st, correct?
I believe that's correct.
And in your testimony, written testimony today, you echoed that QSSI completed code for Data Services Hub in June, that you did the testing, there was an independent security risk assessment completed on August 30. Is that correct?
That's correct.
And today in your testimony, you said that you shared the problems that you identified with CMS. Were those problems shared after the September 10th hearing then?
Yes.
Okay, and I would request that you would supplement your testimony today by telling us the problems that you identified to CMS. Will you please do that for us within 20 days?
Be happy to get back to you.
Thank you very much. Now, did your organization do testing with a number of 200 people and that testing failed? That's what we've been seeing in the press accounts.
I'm not familiar with all the accounts from the press. What I think you're referring to is the testing that occurred in the final days leading up to the October 1st launch.
And was that done with only 200 people?
That was I know that was a test. My understanding is that was a test that failed once the systems began to be finally put together for the first time.
Okay, but were there tests done with more people coming into it as well?
Yes.
Okay. Now, there's one more thing I want to talk about in the time I have, and that's this issue of privacy. Because in my opening statement, I said that I was really touched by the people on the other side of the aisle trying to work with us. But when I heard my friend and colleague, Mr. Barton's statements, and I saw his slide, which fortunately I got a copy of since I couldn't see it, I realized that, in fact, a lot of people don't want the Affordable Care Act to work, and they're raising all of these specters. And this privacy issue is a specter because Mr. Barton's questions, I'm sorry he's not still here, because his questions came from an article in the Weekly Standard where there apparently is a line of code which says, and it's not visible to the user, it's somehow in there. It says you have no reasonable expectation of privacy regarding any communication or data transiting or stored on this information system. And so this is sort of some standard boilerplate, but Mr. Barton is assuming this violates HIPAA. But it would only violate HIPAA if people were putting their personal medical information into the application. And so I want to ask a couple of questions about that. As I understand it, you don't need any medical information to enroll people other than the question, do you smoke? Is that correct, Ms. Campbell?
That is correct.
Is that correct, Mr. Slavitt?
It's my understanding.
And is that correct, Ms. Spellisy?
We wouldn't have visibility into that.
And what about you, Mr. Lau?
That is correct.
So people aren't putting confidential medical information onto the internet, and so therefore they wouldn't be violating HIPAA. And I am disappointed that my friend would go down this road. And I would ask unanimous consent to put that article in the record, Mr. Chairman.
Without objection.
I have one last question. When can these exchanges be ready, and when can people get on them with reliability? Ms. Campbell?
As soon as possible. We're working as hard as we can.
Mr. Slavitt?
QSSI systems are currently ready. We're doing everything we can to maintain them, and we'll do everything we can to assist.
I just
being
want to
ready.
say, Mr. Chairman, my health care aide went on to the National Exchange. She lives in Virginia last night. She was able to register. She was able to research plans. I hope this happens for all the rest of America.
Gentlelady, yield.
I have no time.
Gentlelady,
Here, I just went on my iPad, and I was able to access the choices of plans to my constituents in California in the 5-10 minutes period.
gentlelady's time has expired. Mr. Terry.
Thank you, Mr. Chairman. And